Critical nursing interventions for airway obstruction focus on rapid assessment, intervention, and ongoing monitoring to ensure effective air exchange and prevent respiratory compromise. Here are key nursing interventions for managing airway obstruction. 1. Assessment. Quickly assess the patient's airway patency, breathing, and circulation using the ABCDE approach: airway, breathing, circulation, disability, exposure. Identify signs of airway obstruction, such as stridor, decreased breath sounds, use of accessory muscles, and altered level of consciousness. 2. Positioning. Position the patient in the semi-Fowler's position or in a position of comfort to optimize respiratory mechanics and facilitate breathing. 3. Clearing the airway. Perform the Heimlich maneuver or abdominal thrusts for conscious patients with a partial airway obstruction due to foreign body aspiration. Use suctioning equipment to remove secretions, blood, or vomiters from the airway for unconscious patients or those unable to clear their airway effectively. 4. Oxygen administration. Administer supplemental oxygen via nasal cannula, face mask, or non-rebreather mask to improve oxygenation and alleviate hypoxemia. 5. Airway maneuvers. Perform head tilt chin lift or jaw thrust maneuver to open the airway and facilitate effective ventilation. Consider the use of airway adjuncts such as oropharyngeal or nasopharyngeal airways to maintain airway patency if indicated. 6. Bag valve mask (BVM) ventilation. If the patient is not breathing adequately or has inadequate tidal volume, initiate bag valve mask ventilation to provide positive pressure ventilation while awaiting advanced airway management. 7. Advanced airway management. If the patient's condition deteriorates or if initial interventions are ineffective, prepare for advanced airway management techniques such as endotracheal intubation or insertion of a supraglottic airway device. Ensure proper sizing, insertion, and confirmation of device placement through auscultation, capnography, and chest rise. 8. Continuous monitoring. Continuously monitor vital signs, oxygen saturation, end-tidal carbon dioxide (ECO2), and respiratory effort. Assess for signs of respiratory distress, cyanosis, or deterioration in mental status, which may indicate worsening airway obstruction. 9. Collaboration and communication. Collaborate with other healthcare team members, including respiratory therapists, physicians, and emergency responders, to coordinate interventions and optimize patient outcomes. Communicate effectively with the patient and family members, providing reassurance and education about the ongoing management of airway obstruction. 10. Documentation. Document all assessments, interventions, patient responses, and changes in the patient's condition accurately and promptly in the medical record.